Welcome back, Little Helpers. Today, we have Dr. Kibby McMahon as our guest and co-host talking about her pregnancy. So we're doing a pregnancy episode today. She just announced her pregnancy on Instagram to all her friends and family, even though, of course, we talked about this last week in our drinking episode. But we wanted to do a whole episode on this because we've talked so much about infertility and struggles to get pregnant, and then bam, our favorite co-host in the whole world is pregnant very suddenly. So, Kibby, how did it happen? How did you go from this undiagnosed, or whatever it's called, infertility to now being pregnant?
God, I have no idea. Not at all. My marriage before this relationship, I think I've talked about this a lot in this podcast, but I'm 36, and it's just a real big surprise to me because I'm healthy and I'm older, but I'm still healthy and had no fertility issues or no major problems. But my ex-husband and I could not get pregnant for 2 years. Like, we tried for many, many months and did different kind of treatments like IUI, and we did IVF, and it just wasn't working. And it was just a horrible feeling. I was just so, I was depressed and anxious. And for 2 straight years, I just had to accept a possible reality that I could maybe never get pregnant naturally, which is something that I didn't realize I dreamed about until it was taken away. I was so career focused, I didn't even know that was something that would hurt so bad to lose. So I had to go through this whole personal growth, spiritual, I don't know, whatever, walkabout, to kind of accept my fate. And then in my new relationship, after my divorce, I just had I had no hope. I was just like, okay, let's start trying. But I'm hoping that IVF will eventually work. I'm not sure. We might have to adopt. I don't know. And then it just happened right away. So
Like right away.
Yeah.
Like she went off birth control and that month got pregnant.
Yeah, it was, I'm saying this just because if anyone has experienced infertility or anything like this, it's such a frustrating, out of control experience. And people told me all the time, you don't know how your family is made sometimes. You don't know how your child finds you, whether that means, I took that to mean through infertility treatments or adoption, but I also didn't realize like how many experiences were like this. People who struggled with infertility and then bam, they were on the waiting list for adoption and suddenly they got pregnant, or they switched partners and suddenly got pregnant. So it was just I have no idea what happened. None.
Yeah. No, I mean, it's just so funny. Like, this just happened to another one of my best friends who's also 36. Just years of being told, like, you're not going to get pregnant naturally. This was an endometriosis case. And then it was actually IUI, but it just, like, worked immediately. And I don't know. It must be such a mindfuck to go from this spiritual walkabout you've been doing with yourself, like, getting yourself accustomed to the idea of a different kind of family. And then, boom, dreams come true, like, instantaneously.
Yeah. Yeah, these are all weird. Like, how to start a family, or whether you start a family, we all just assume we have so much control over it. Like, we think, do I want kids? Do I not want kids? No one really thinks themselves, can I have kids? You just take that for granted. And so when that was all called into question, and then when you're given that gift, at least now I really appreciate the miracle of life. Like, we're scientists, and, I would love scientific explanation for what was going on, but I
have a scientific explanation for what happened.
What is it?
Well, I've made this joke to you too many times, but Kibby has Excalibur eggs. They could only be impregnated by the one true king, which was her best friend Alex of 17 years. He came in, impregnated her immediately. They were like, fuck this dude with her ex-husband. They're like, absolutely not. You can't have me, only the one true king. And then she found him.
There you go. So...
It's my scientific explanation.
Yeah, so be an infertility consultant. Like, do you have Excalibur eggs? Maybe we all do. Who knows?
Yeah. If I can't get pregnant with Paul within 2 years, I'll know what's going on.
Blame him. Yeah.
It's not the one true king, Paul.
No, we're kidding. We're kidding. Just to make sure that people know that we're kidding about that.
We are kidding. It's like you went too far, Jacqueline. So you got pregnant, and then what was your first thought? Do you remember?
I cried. As soon as I had taken so many of those, I peed on so many sticks and taken so many different tests, and I was just so used to being used to seeing that one line, and then right away was 2, and then I took another, and I just cried. Yeah.
So back up. So then were you late? I mean, but you had kind of an inkling, didn't you?
I was at your bachelorette, not bachelorette, your engagement celebration, and I was late, and that was my only inkling, really. I think I really was like, oh, I'm a little bit late, and I did feel a little bloated in a way that I wasn't used to, and Alex was coming to visit, and the first day he was here, I was like, I don't know, I just maybe this is it. And I remember driving to CVS, driving to get the pregnancy test in the morning, and thinking to myself, are these the last few moments I have before I find out I'm going to be a mother? Okay. And then I drove back, did the test, right away it was positive, and cried, and then shoved a stick at his face to wake him up in the morning. So that's how those first few moments were. Wow.
Did you have that inkling before all the other times you peed on sticks?
No, I really, there were so many times, because when you're on fertility, and that's the worst part, when you're on fertility meds and doing treatments, you have so much hope. You have you just pray. You go through this whole cycle of doing the fertility treatment, whatever it is, waiting for those couple weeks where you have to wait to get the test, and you're trying to distract yourself, but that's all you could think about. And then every symptom you have, you just magnify. Like, I'm like, oh, I'm a day late, or I feel a little nauseous today. What's that all about? You just get so hyper vigilant for signs of hope. And then you get maybe a negative result, and you're like, I'm going to wait a little bit, and you get another one, and there's a moment where it clicks and you realize that I'm not pregnant, and then it just crushes, and then you have to wait a whole new cycle. So I've had inklings before. And so I don't know what was different with this one, but yeah, maybe I just had a little bit more hope, or there was an instinct that I knew, but I'd be lying if I said that this was like I had an intuition. I had that intuition other times and been really disappointed. Okay.
Yeah. So what was that first trimester like?
Oh my God. Anyone listening out there who's a mother, oh my God, I have such newfound respect for working women in general and working mothers, because I was so nauseous and so tired. And I know everyone's pregnancy is different. So some people are like violently ill, and some people don't even feel anything. Mm-hmm. I felt really exhausted. Like I had the flu, but worse. And it was all I could do to not fall asleep in all my Zoom meetings. And I couldn't eat anything because everything grossed me out, but I was starving. Mm-hmm. So you're just looking at all the foods that you love, and you just can't eat them. And the one thing you eat is maybe like crackers. And it's just like I would just be so upset that my favorite foods wouldn't do it. And and I am so thankful that my job is remote, and my boss, our advisor, is understanding and flexible, because I don't know how people go into an office and be doctors or any other kind of in-person thing, because I could barely sit up. I could barely focus on anything, and any break I had, I passed out. So it was tough. It was really tough.
What was that like for you? I mean, we've talked in so many episodes about your neuroses around whether you're working enough. Mm-hmm. And suddenly it's like you're incapable of doing that, but you still have this job you're supposed to do.
Yeah. And we'll talk about that more, because there's just so many things in pregnancy that could lead to a lot of mental health issues for women, like anxiety, depression, and all these different things. And I think changes in identity and your role are huge. And I think the pandemic and recent situations, I've kind of let go of the identity that I had, which is someone like a workaholic, basically. I mean, I still feel like I'm a workaholic. There's one in recovery, or I don't know. am in rehab for my workaholism. But I just always expected myself to do a lot of different things all the time, right? To be busy, to be productive. And I just physically couldn't. And I was just angry about that. And I was angry that I think it kind of highlighted like how much pressure there is on women to do everything. And I really felt like viscerally that I can't do that. Like I can't be pregnant and eventually be a mother and put in as much effort and time and energy into work as I did before. And honestly, I worked my butt off all through grad school. I used to work every single day for at least 10 hours a day, nonstop, with lots of caffeine and Adderall prescribed. And that was my way of like keeping up. And then I couldn't even stay awake. I couldn't even,
Yeah.
And I just, so I just realized that I was just trying to run up a hill with a broken leg, and it hurt a lot to kind of think about that I might not be that person again for a very long time, or had to adjust my expectations for myself.
Yeah, it's crazy to think about, especially wanting multiple kids, like how much this can set us back. I mean, and actually I will do a whole kind of segment in this episode on medication during pregnancy, but amphetamines are ones you really shouldn't take, correct?
Yeah, I mean, we're not psychiatrists, so we don't know this for sure. I just remember working in the women's clinic at New York Presbyterian, and I've learned from the psychiatrists, they were saying, listen, there are some medications that are actually dangerous to take during pregnancy, but for a lot of them, we don't have enough research to show that it's problematic, and they do know that whatever's good for the mother, whatever keeps her calm and happy and functional and lets her live her life the way she needs to, that's the most important thing. So
ADHD meds are sometimes...
They do recommend my doctor said don't take them, right? Okay. And but they did say if that puts you at risk, like if you're going to crash your car or cause any kind of like harm to yourself, we'd rather you be on some kind of medications than that.
It's just interesting. Like not taking Adderall isn't going to put me at risk for anything except failing out of my PhD. So I mean, it's funny. I'm like trying to plan the timing of my pregnancy to correspond with like the year when I'll have least need for Focalin, and like will be most able to cope with the program and pregnancy, which I've decided is next year. But I mean, it's just wild thinking like, okay, it's time to really map out my life according to when it's okay for me to be at peak exhaustion, because that's what's coming. Yeah.
I have to tell you, my learning from my experience, I know everyone's different, but that was like the first lesson of letting go of being able to plan things as a, mother, because I did that too. You
tried, yeah.
I tried everything. I even got a specific grant to let me do that in a specific year. And I like to plan things, and it did not happen that way. And I was so frustrated and so panicked to make that work. And I realize now we can't like fit it all in puzzle pieces so it fits perfectly. Like a kid's going to come when he or she wants to come, and we just have to accommodate. So it's got to be like on the fly working with this. And I do wish that the employment status or institutions are way more understanding about that. But we gotta do that for ourselves.
Yeah. You took an extra year of your PhD so that you could have a kid that year. Yeah.
And I
didn't have a kid.
I was just a super senior with no child. Yeah. So that was fun. It was fun.
Now we can laugh at it.
Yeah.
So second trimester, better?
Yeah, I mean, I'm due in August, so that's when we might take a break from doing this podcast for a little bit. But second trimester for me is a little bit better. I do see why some people why this can be stressful, why this could lead to a lot of anxiety. I luckily have a lot of support and coping skills, but this is the time when you realize that this is a real human. Like you go from this like sickness in first trimester to the last couple weeks I actually can feel him moving around. It's awesome. A boy, by the way. Yeah. And seeing the ultrasound, and then I started having dreams recently. Ugh, this is awful. In the past like week or two after, kind of like connecting to him as a human being, I started having dreams of like, I'm taking care of a little puppy or a little baby and something disastrous happens. Like the puppy jumps off the window, or, there's something terrible where it's at risk. And I wake up with this fear or this sadness that I was in charge of something, like a little life, and, they died or something terrible. And I was like, oh my God, I'm starting to feel what it's like, that mother worry that everyone talks about, but just the amount of responsibility it is to like have another person, little thing's life in your hands. And
an incredibly fragile little thing.
Yeah. 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 And then you start to hear all of this advice from people, which are really helpful. But when you start to read the things and you start to learn about the test of the different disorders that your kid may have, it gives you the impression that any little wrong thing could destroy this kid's life, right? Mm-hmm. Like suddenly I'm going to the doctor, getting all these tests for diseases that are horrible. And I was like, oh my God. And then they tell you don't eat too much sugar because that could put your baby at risk for gestational diabetes. And I was like, I was just having a cookie. And now suddenly I'm like risking my child's life. So everything becomes like way more, like any kind of mistake becomes way more amped up. And I know that actually in reality, kids are very resilient and this is all fine. It's all try to minimize risks, but it could get stressful.
Yeah. I mean, it's remarkable that every woman in history went through pregnancy and didn't know any of this. Mm-hmm. I mean, didn't know it was bad to eat sushi or to drink alcohol or to smoke. And by and large, civilization has been okay. I mean, but now all of a sudden, we've got Google. It tells us all these horrible things we could be doing to our kids, and we shouldn't take meds, or we shouldn't eat certain things, or we're going to destroy their brains. I mean, that's just so much responsibility to have on one person's shoulders.
Yeah, and it's really hard now to know what is actually like safe or not safe versus just dogmatic advice about there's a lot of people who think parenting should be specific ways, right? Breastfeed or don't breastfeed, formula, all these different sleep training, not sleep training. And you don't really know as a new parent, like what is mandatory and what's just like opinion. Yeah. It's really hard to sift through that. And you want the best for this thing. And it's hard to then be relaxed on certain things that you're not sure if that will be the make or break kind of factor.
Yeah, this podcast episode is interesting because it almost works well with our theme of how do you help your loved ones. And often that means setting boundaries. And I can see how we talk all the time about like put on your own oxygen mask before helping others. That almost kind of works in this mother-fetus relationship as well. Mm-hmm. Because like, for instance, as you were saying with medication, the medical advice you're most likely to get, or that you should be getting rather, is that you should keep taking the medications that keep you calm, peaceful, and happy. Talking about psych medications. So a lot of people will try to stop their SSRI because they're pregnant, and then they'll go in to see their therapist, and they will have a relapse of anxiety or depression. They'll be going through withdrawal, which can be pretty strong. Mm-hmm. Sometimes they'll go off their bipolar medications, and then you could have a manic episode. And the advice is really stay on these things. There are some exceptions. But it's better if the mother is happy and healthy than to risk the truly minimal risk to the fetus.
As you're saying, all of these decisions with medication and treatment should be with your, consulting your doctor, right? And to kind of just go off of like lay theories or opinions and just go off medications just because you're scared. That's not really advisable, right? It's like always consult a medical professional. Yeah, and it's a really particularly vulnerable time, right? We're scared, we're entering this new phase, and it just, you and I have been looking at the research about mental health and pregnancy, and it says that like about 20% of women suffer from mood or anxiety disorders during pregnancy. And particularly people who are vulnerable are ones who have history of anxiety and depression. And people who have had fertility struggles are most likely are more likely to have postpartum depression. So, I mean, making sure that you're cared for psychologically during this time is really, really important. But it is a balance. You're suddenly in this new role of like caring for this thing, and all of your energies are going to be directed to making sure this thing stays alive. But then there's things about, that kept you sane and happy. Like, I had my glass of wine at the night to wind down, and now I can't. And it's like, well, what am I doing? Am I helping myself or helping the baby? So it is this, this new transition towards like, how do I actually balance like my needs versus my child's needs? Starts early.
Yeah. I think with regards to medicine, the research is basically saying like, first of all, we're not done researching this. And some of these drugs, just there hasn't been much research done. But I think it's looking like the results for SSRIs is that there's really no reason to believe there's any risk. Yet, I mean, more research could come out. But there is potential risk to the baby from depression. I think higher rates of premature birth and some other negative outcomes. So it is important to keep in mind that, like, if you have depression or anxiety, that doesn't mean you shouldn't have kids or anything like that. It just means that it would make sense to actually really pour resources into that, into getting yourself happier and healthier. I read bipolar is just an especially important one to be monitored actively by a psychiatrist. There are some negative outcomes with Depakote, so that is one you might be advised to transition from. It looks like Lamictal or lamotrigine, which is a medicine I gushed over in their bipolar episode. It looks like that one's okay so far. But there's a very real risk, if you slip into real depression from bipolar, or the opposite with mania. I mean, mania with psychotic features that may make you think about your baby in a different way. It could put you at risk of harming your kid. So it's just, again, like, it might be better to be medicated. And for most of these medicines, we're finding that there's just no negative outcome anyway, so it's not something to worry about. But again, just consult your psychiatrist before withdrawing from medicines.
And I do have to say that I know this is not available everywhere, but there's some hospitals and some clinics where there's some psychiatrists or doctors who are especially trained in both perinatal, like, pregnant women and pregnancy, and psychiatry. So, you could ask to see someone with that kind of specialty if that they're available in your area. So I was surprised by that. I didn't know that was a subspecialty.
Yeah, I think that's a great piece of advice in general for pregnancy, is that there are perinatal mental health clinics in many cities, and you can look this up and see if your city is one that has one. And then that's people specializing in mental health in people who are pregnant, or they just had their kid, and so it can be great to have that specialty.
I think, like, what even just listening to us talk, I'm just thinking about how we're lucky that we're psychologists, so we're kind of like cued into all these things, but for the loved ones of people who are just getting pregnant or just announced their pregnancy, there's so much positive feedback, right? Everyone's excited. Everyone's like, how do you feel? This is so great. Are you happy? Right. And often the answer is yes, sometimes no. Yeah. But there also is, a lot of hard pieces to it that a lot of people don't talk about, right? You just talk about, like, when's your baby shower, but you don't talk about what are your anxieties, what are you afraid of, what do you do if you are on medication, right? What are you afraid of losing, right? So there's I don't want to say the dark side, but there's just a lot of layers to the experience of pregnancy, kind of like with any life transition. And usually it's so positive, but a lot of the hard parts are hidden in private.
Absolutely. I mean, well, especially when the pregnancy is unwanted, because that happens all the time. The pregnancy is going to cause a lot of financial difficulty, strain, how it, maybe how like previous children have affected your partnership, and anticipating that again. So yeah, I mean, have any of these kind of darker sides come up for you?
Yeah, I think I had it more when I was grappling with infertility than I do now. I feel like I'm in a good place now. But I identify with some, and also I ran a group in the women's clinic where we had a set number of sessions, and it was a group of women. Some were pregnant, some already had children, but a lot of it was focusing on CBT and interpersonal therapy, so cognitive behavioral therapy and interpersonal therapy techniques for working with different kind of anxieties and stressors that come up with pregnancy and motherhood. And I think that we talked about like the change in identity, and that's a huge one, that there's a lot of loss involved in any life change, even an exciting one. So this was of course a wanted pregnancy, but there was a lot of who I was in earlier on, and the kind of person that, is just can do work no matter what, no matter what time of day, unstoppable, this kind of thing. And I have to change that. So that's hard, like losing a part of yourself or losing the way you saw yourself without knowing what it looks like when you're a mother, right? Without actually getting like the baby, and seeing what you're like as a mother. You have to lose, I used to travel a lot. Like, can I still travel? Can I still do all the things that I used to do before? And so that kind of like life transition, identity transition is really difficult for a lot of people.
This is something I think about so often. I mean, there's the loss of the single person and all of the kind of like privileges that come with that, like having more free time and travel and money. But there is this idea of, you're meeting a new version of yourself for the first time that you just can't really predict before it happens. You're just taking such a leap of faith that you will appreciate this role, that you can do this role effectively. I mean, but I was just thinking about, like, I don't really know who I am with other kids. I'm the youngest kid, like, in my family. I didn't have siblings that were younger. I didn't have cousins, really. I had 2 cousins, but they lived far away. And I never really babysat. Like, there are so many things that I don't know yet about myself and who I'll be in this most important role I'll ever have in my life. And you're just going in blindly and you can't go back. Well, I guess you can, but then you land in prison and that's a new identity.
Yeah. And when you talk to your friends, I mean, I've had, I have a lot of friends who have had kids. So I got to, kind of see and observe first. So, but when you talk to people with kids, a lot of what they talk about is the negatives, right? Because they're so tired, right? I'm so tired. I'm sleep deprived. It's so hard. I haven't had a moment to myself. I can't even pee alone, right? And I'm like, oh my God, all of that. I'm like a workaholic who likes her privacy. I don't know. And I love my freedom, right? So, but, and then the things that you get are ineffable. They say like, I've never experienced this kind of love. Like, I just want to stare at my child all day. It's a love I've never experienced. Like, I now have new purpose in my life, right?
Yes.
All that sounds awesome, but it's way less relatable than I'm exhausted from no sleeping. Like that, I'm like, I know what that feels like, and that sounds terrible. No, thank you. So it is hard to kind of step into this role that blind.
Yeah, Paul Bloom is a psychologist, and he just wrote The Sweet Spot, The Pleasures of Suffering and the Search for Meaning, which, of course, is a book that will probably appeal to us because of, we love Viktor Frankl. But he was talking, I was listening to him on Dak Shepard's podcast, and he was talking about how when you interview new parents or parents of young children, they are often less happy. But they're more fulfilled. Yeah, and that's the trade-off.
Yeah, we'll have a podcast episode if that's true. I'll tell everyone if that's true.
All right, so stay tuned. Yeah, but I mean, that's kind of the point is, like, happiness isn't always the end game. We think maybe that's the purpose of the life, but it seems like fulfillment is actually closer to the truth. That's what people crave more. And they're willing to suffer quite a lot to get it. And in fact, the greatest fulfillment comes with a large dose of suffering, because that makes it worth it in a way.
Yeah. It's interesting also to watch my body and my mind react to preparing for that suffering, which I didn't expect. There's all these little shifts in me that maybe just are hormonal, but there's some practical, like how am I going to get all my work done and set up a home, like the nesting kind of instinct, like how am I going to set everything up so that I'm set up well for this child, and like, have time, energy, and space to give to and finances, like for a lot of people, and just all the different practical considerations is very stressful. So having at least, like, I'm lucky that I have a partner that we're on board with a lot of this stuff. I know that's a point of contention for a lot of people where, where are they going to live? Like, what are you going to do with, how much you're going to buy? How much, all the different, are you going to move somewhere? All those different factors. But I also sense a shift in how I want to spend my time and energy. Like I had this draw to Alex, my partner, like this physical, like craving for him, and also a real repulsion. Like I really want to avoid any situation that feels like unstable or unsteady.
Okay.
Which is funny. I mean, I'm such a social person, like we both like to go out to parties and, meet new people, but I find my tolerance much lower. Like as soon as I see someone who might seem like draining or unpredictable or, usually I'd be like, that's interesting. Let me hang out with that person. And now I'm just like, no, thank you. I'm just gonna...
Is that partly because you can't drink anymore?
No, because it's not necessarily like bored or I don't think that alcohol would have changed that.
Yeah.
It's almost like this. I noticed this in first trimester more, where like certain smells of people or certain people who, going to some bars, like some people just seemed erratic or dangerous. Like drunk people or people who smelled a certain way. I just couldn't be around. Whereas normally I'd just walk into like a Berlin rave and be totally fine with the whole situation. So it's really like this, you feel very vulnerable. Like,
yeah.
I was at the airport and they couldn't find my bag for a minute. And I just stood there. That situation wouldn't have made me blink an eye, but I felt so helpless. Like I felt like this little, like vulnerable being that, was at risk of danger, and I just wanted my bag to go home. It shifts like your orientation towards safety and predictability.
That's so interesting. I mean, it makes complete sense. Your values are shifting towards protection instead of woohoo curiosity. But I can also see how it would be difficult to feel that vulnerable when you also feel like you're supposed to be a protector.
Yeah. I pride myself on being an independent woman, but I remember, thinking at that airport, I was like, I can't travel without a person. I can't I don't want to go into unfamiliar places without someone else to protect me. And I was like, that was a weird thought, Kibby. Like, what do you mean protect, and I was like, I don't think I can like run away, or if something happens to me, it will happen to my baby too. So there's a huge shift in me.
That really brings up, too, the anxiety and depression that single mothers must struggle with immensely. Just being all alone.
I really, this experience has really made me realize like how precious and insane this experience of becoming a mother is. Like how women can do this and then go to work. Like it's just, I'm still blown away. It's just like, it is so... I see what they mean is so hard, because it's just, you just have to juggle so many different factors, like how your body's feeling, this baby, like the practical sense, like it's such an amazing thing that we do, us women. I'm just giving props to us. So. Another thing that I can imagine leading to a lot of, anxieties and maybe depression or other kind of mental health struggles is just coming in with our expectations or beliefs about family, which really crystallize and come to focus when we, meet the person we want to get, partner with and start to have a family with. how you were brought up, what you liked about it and what you didn't like about it, your beliefs about it, can all kind of be suppressed when you're in your 20s and free and single and just not focusing on those things. And eventually you're like, I'm going to make a family. It's going to be amazing. But then when you actually start, first of all, you realize that you're probably a lot more like your parents in ways that you don't like than you realize. Like, I realized, like, oh, I'm way more like my mom and dad in these ways that you just start to default on these schemas of family. Like, what does the mom do? What does the dad do? What's their partnership like? How are you going to raise a kid? Like, what kind of values do you want to impart? What do you do when you're stressed out? Do you yell at the kid? Do you hit them? Do you take moments away? Do you drink? Right? Like, all these things that you didn't realize that was part of your upbringing. If you aren't like conscious of it, can actually play out again in your own life. And that can be really scary for some people. And for some people, I feel like that's why they are afraid to have children, or they're afraid to talk about families, because they are so scared of ways that they grew up.
Yeah, I have multiple friends who had decided not to have babies because they had had a bad childhood. They just didn't trust what might flower in them. Exactly that. Like, a friend who had a mother who just wasn't very good at motherhood, and she was so concerned that this was going to come out in her as well. She had the baby and she's great, and then now she's having another one. But it was a very real fear of her, and I guess that kind of speaks to also what I was saying. It's like you're about to meet yourself, this new version of yourself, and you're going in blind. You don't exactly know what's going to happen, and so that can be extra scary. Now, you probably do have some predictive abilities. I mean, you're probably not going to become a raging psychopath when you never have been before. So I think there is reason to trust in yourself, but that there's just so much uncertainty.
Yeah, and I think that with therapy, that was something I saw in the women's group, and also working in CBTs with people who are about to become mothers. It's like you can actually take a step back, look at the patterns and beliefs that you came in with, right? That you got from your childhood. And then, see what things, what patterns or characteristics you might have in yourself, and, and really define your values. Like, oh, I grew up in a chaotic environment, where there's a lot of like yelling and like terrible conflict resolution. And I know that might be my default. Like, if I'm upset, I might yell at my kid, but my values are to teach good emotion regulation and handling conflicts with a collaboration and love instead of the opposite. So how would I want that to look, right? Yeah. So you could kind of like think carefully, introspect, and plan. And therapy is a great place for that. And there's a lot of different kind of therapy support groups and things like that for women. It's a good place to think about that.
Yeah, I mean, I was going to say it would just be such a positive kind of predictor that you're already thinking about these things and going to therapy and trying to change the past, or trying to, make sure the past doesn't repeat itself. Rather. Yeah. Another just kind of class of thoughts that I think really freaks out pregnant women and new moms is baby harming thoughts. So I just wanted to quickly normalize this. Almost 100% of women have thoughts about harming their baby. About 50% of expectant mothers or recent mothers have thoughts of intentionally harming their baby. So the other 50% is basically like, oh, what if I bring accidental harm onto my baby? Just because they have these thoughts does not mean they act on them. Sometimes it might actually be protective. You're so freaking anxious about harming your baby that you then have these thoughts about harming your baby. And sometimes it's because your baby is screaming nonstop and you do want to throw it out the window. I mean, so again, it's just like there is this part of treatment that is understanding you are allowed to have thoughts.
Yeah, that's a really common, especially like obsessive thoughts about harming a baby, like a picture of doing something terrible to your child that you don't want to do. That's a symptom. That's one of the symptoms of postpartum depression. And I think, anecdotally, and, my clinical experience, that's one of the symptoms that people feel really ashamed of and scared to disclose to their partners or a professional, because they don't know that it's like a postpartum reaction, and they think it's real. They're like, oh, I have these thoughts. I'm so used to my thoughts meaning something I want to actually do. And they're scared that other people are going to like take their baby away or, hospitalize them or something. So I'm sure a lot of women who have those thoughts keep it to themselves and suffer in silence. So.
Yeah, I mean, this is just another place where it feels like there are so many guidelines from society about how we should be as mothers and just how we should just love our children unconditionally. And, it's just such a privilege and a joy to be carrying life. But it's got to have such like a filthy bed of nasty thoughts and anxieties and fears, and like if people would just kind of shine the flashlight on that and say, oh my god, you also imagine throwing your baby out the window. Like, yeah, okay, yeah, you're not going to do it though either. Okay, we can keep going.
Yeah, there's a lot of judgments and stigma involved in motherhood. Like a lot of current mothers have complained about mommy groups or things like that. I remember talking about the mommy groups, like forums or online communities or things like that, or blogs. And everyone in the group would roll their eyes. They're like, oh, I hate them. And I was like, what is this world that I don't know about? And it's just like these really like holier than thou bloggers or communities that just, I guess their intention is to try to give advice, but usually it comes across really condescending and judgmental. Like breastfeeding is the best way, and if you don't do it, you're basically a terrible mother, or, all these different practices that they like, and they want to say that it's better than you if you don't do it. So it really promotes this idea that motherhood is about like this perfection. And I mean, tips for loved ones, like, don't do that. like remember that every mother is different. And, there's children who have raised in all sorts of ways all across the world, right? Like, in like cattle fields, right? And the dirt, right? And they're fine. And, so yeah, just kind of accepting that we all have different approaches to what's right for our baby and our own family. I forgot where we're going with that. But
the breastfeeding thing really pisses me off because different women have different biological capabilities with that. I mean, I think my mom had like 3 months of milk in her max. It was formula from then on. And I'm sure that's what caused my ADHD. It's just all all the fault of her boobs.
Exactly. There's so much shame around it. I even felt that in infertility. No one said it to me, but just because I couldn't get pregnant in the way that everyone on social media was doing, I felt like lesser than. And I just wish that we wouldn't normalize all the different anxieties and capabilities and choices and things like that for
I mean, some women have differing abilities to like gain weight during pregnancy. Like, so for some reason women it's really hard to gain the weight, and then they feel like they're starving their kid. For some women they feel like they're gaining way too much weight, and then that brings up another topic, by the way, which is people with eating disorders getting pregnant. Yeah, I mean, I would just highly advise therapy, because if in this case, if your fears changes in your body, then this can be just truly terrifying. Yeah, for you.
Definitely. Yeah, I do remember that clinically and personally. It really, you change a lot. Again, like identities and role transitions, and a lot of people have, just a different relationship with their own body, and some people identify with a way they look or the way they feel in their body, and then it all changes, and it really does feel so out of control. Every day my body feels different. Yeah. And it's just stuff that I never expected, and so I really have to let go of feeling in control of my body. But for a lot of people that's a huge struggle, and it's hard.
Yeah, I'm terrified of it. I mean, I'm like spending all this time working out now, like I'm like, is there even going to be a point to this when my body is just this kid, like, basically punches out the walls of my body for 9 months? Yeah. Like, shoots out of me.
Yeah. You shift really quickly from, I used to work out for a lot of reasons, but, a lot of people will work out for, to look good. And then you work out to be able to have the capacity to hold up all this weight and like have a healthy body environment for your child. It shifts quickly, but it changes every day. There's no way to, once you get comfortable with something, then it changes with pregnancy, and I'm sure with motherhood in general. So
yeah, I would think it would also really screw with you to like, I think a lot of us feel like as women, our bodies are these art pieces to be gazed upon by men. Like that's why we work out, is to like look as beautiful as possible, so that and so that men and women, and I'm just talking heterosexually here obviously, but like so that people can gaze upon us and like enjoy us, and then suddenly we become vessels. We become feeders, homes, protection for a tiny vulnerable infant, and that's just a really, really different way of looking at your body. And for people who are really attached, I think, to that first vision, it can be a struggle. Yeah,
your body doesn't feel like your own anymore, which I think that people who might have trouble adapting or letting go of control, pregnancy and motherhood could be a real struggle. I've really leaned, luckily, my infertility situation forced me to do that early. So I feel like I'm applying all those, lessons to here. And just being like, well, I'm just going to celebrate every gift. But yeah, it's hard. It is hard.
So Kibby, before we close out, I just want to see what is the most helpful kinds of things that your partner has been doing, or what do you think would be most helpful? In other words, what can partners do for their pregnant partners?
Yeah, I mean, just kind of like what we advise all the time, focus on yourself first and focus on what you need to do to fill up your cup, so to speak, because postpartum depression or depression in the partners is also common, right? And then they forget about themselves, right? They forget about their own needs. And if they're struggling, if the loved ones are struggling, the partners are struggling, then it's extra hard to kind of be there for the person who's pregnant. So, but the things that have been really helpful is that Alex has always been, he always asks what I need. He always asks for help. He lives in LA right now, so we are across the country. And even just, the constant contact and expressing love and expressing a desire to be with me and dream up this future with me, and discuss. He openly, I don't want to talk about this, but he openly goes, "What are your fears? What do you imagine for our child? How do you want to raise our kid?" Yeah, he really wants to talk about it a lot, because he's actually more anxious about it than I am. But I think that's just been a really nice a way to kind of like work through some things that we might be thinking on our own. And then he'll like DoorDash me like fruit or whatever that I'm craving. So just the willingness to be there, and the willingness for him to, just put the child and the family first, which it might go against like the taking care of yourself, but he's not like seeing this as a burden. He's not expressing this as a burden. It is burdensome. He has a lot of sacrifices for this. Like we all do. He is going through his own role transition, but I think the willingness to be there for me and put this first and really take this seriously has been really helpful in making me feel not alone. And he also thanks me a lot for the biological, responsibility I have. Sometimes he's like, I'm like, oh, he's kicking, or my digestion's weird. He goes, "Thank you for doing this." So that's really nice.
I'm going to extract so many favors from Paul when I'm pregnant.
You should.
It's just going to be great. So put yourself first and put your partner first. Got
exactly.
Got it.
All the things and the baby first above all of those. So, yeah.
I do like the idea in there. I mean, it sounds like gratitude, showing affection and care, and just fantasizing together. Mm-hmm. And being open about the other side of it. Mm-hmm. So just being there to have an honest experience together, but to also kind of paint the future a little bit and enjoy doing that together.
Yeah. Yeah, I think sometimes he has been afraid to share his concerns or his fears or things that he's going through, those role transitions or sacrifices, and because he doesn't want to stress me out more. Mm-hmm. And I'm trying to tell him, especially if he's listening to this, but I'm trying to tell him that sharing those things is really important for us. And I actually think that that's a great way for a couple to feel together in that experience, because we have different ones. I mean, some are the same ones, right? Some of the same fears, but yeah, I mean, these fears are all part of that role transition and like preparing for this huge life journey. So it makes sense to share in it together.
Okay, so just before we end, what do you have to say about treatment? What kind of treatment should people be looking for here?
Yeah, so we were talking about a range. A lot of people have anxieties about pregnancy. That's totally normal. But if you feel like you have anxieties or depression or other mental health symptoms that are like really impairing, like really taking away from your ability to enjoy the process or function on a day-to-day basis, there are some treatments out there that have been really helpful for pregnant women. One approach is the general cognitive behavioral approach, which works with behaviors, thoughts, and feelings involving pregnancy. And there are a lot of different options for that. One way is to find an individual therapist. So find someone with CBT who has some perinatal or women's health expertise. There's also a lot of groups out there. There's some support groups, but I really recommend ones that actually are based in therapy and, are monitored by or like managed by a therapist or counselor or any kind of licensed clinician. Because they're going to also teach skills to help cope. It's not just going to be talking and supporting, which is really helpful, but it's also teaching like different ways to work with those anxieties. And for people who don't have access to individual or group therapy, there's a really good book that you look up, Pregnancy and Postpartum Anxiety Workbook, Practical Skills to Help You Overcome Anxiety, Worry, Panic Attacks, Obsessions, and Compulsions by Kevin Garco and Laura Miller. And so that's a really good book because it gives some tips and some CBT-informed strategies to cope. But also another kind of therapy that's been really helpful is interpersonal psychotherapy. There's a lot of adaptations for perinatal depression, so depression found in pregnancy. And if you could find any kind of treatment like that, it really talks about how like the role transitions and other interpersonal conflicts and issues that come up in pregnancy that might contribute to depression. So a book that you could look up if you don't have those resources is Interpersonal Psychotherapy for Perinatal Depression, A Guide for Treating Depression During Pregnancy and the Postpartum Period by Margaret Spinelli.
Awesome. Thanks, Kibby. And we can also post a site that kind of goes through what the research has found about different classes of medications and some individual medications as well. So I hope you enjoyed our episode. If you are not too pregnant with morning sickness and everything, to rate, review, and subscribe to our podcast, please go ahead and do that. And we will see you all next week. By accessing this podcast, I acknowledge that the hosts of this podcast make no warranty, guarantee, or representation as to the accuracy or sufficiency of the information featured in this podcast. The information, opinions, and recommendations presented in this podcast are for general information only, and any reliance on the information provided in this podcast is done at your own risk. This podcast and any and all content or services available on or through this podcast are provided for general, non-commercial informational purposes only and do not constitute the practice of medical or any other professional judgment, advice, diagnosis, or treatment, and should not be considered or used as a substitute for the independent professional judgment, advice, diagnosis, or treatment of a duly licensed and qualified healthcare provider. In case of a medical emergency, you should immediately call 911. The hosts do not endorse, approve, recommend, or certify any information, product, process, service, or organization presented or mentioned in this podcast, and information from this podcast should not be referenced in any way to imply such approval or endorsement.